Well, good morning, everyone. Today we are here at Memorial Medical Center, and we are doing our updates that we've done throughout the pandemic. But today we are also going to be joined not just by Dr. Davis, our health officer, but also by John Bishop, who's the CEO of Long Beach Memorial, Carolyn Caldwell, who is the president and CEO of Dignity Health and St. Mary Medical Center here in Long Beach, and by Joe Avlino, CEO of College Medical Center. And of course, our partners at Community Hospital, while not here today, have been a big part of our work as well as we kind of reestablish this next year around healthcare and really focus on public health. Now, I just want to kind of give everyone a reminder of kind of where we were at the height of the pandemic. We were just actually here at the same location just 6 months ago, providing our very first vaccination in the city of Long Beach. And if you can believe it, since that time, we have done more than 250,000 or 250,000 vaccinations since that very first vaccine happened at this very location that we are in. We'll also note, just to highlight the severity of where we were and where we are today. Today, there are 3 COVID-19 patients here at Memorial. At the height, there were 220 at just this hospital alone. 220 patients here at Memorial versus the 3 that there are today. Now, we know that next Tuesday, June 15th, along with the rest of the state, Long Beach will be moving on to its next phase of recovery. And today we wanted to take a moment also to extend our appreciation to all our amazing healthcare providers, many of whom are here standing right next to us here, for their incredible dedication to the community. We want to thank all of our doctors, our nurses, our technicians, our custodial staffs at our hospital, all of our administrators, our nurses' assistants, all of the workers that have brought patients in, taken care of families, provided care, not just at our hospitals, but also across the city. They are all heroes, and we are just incredibly grateful that throughout this pandemic, they have been on the front line, just saving lives every single day. We thank them and all of our hospitals and clinics across the city of Long Beach. And as a snapshot, we know that as of today, we've had about 53,468 residents that have actually tested positive for COVID throughout the entire pandemic. There are currently 9 residents total hospitalized with COVID-19 that are Long Beach residents, and there are 8 in Long Beach area hospital. So 1 is not at a Long Beach area hospital. And since the beginning of the pandemic, we've lost 942 Long Beach residents. Your city and our partners have conducted more than 800,000 tests. And about 16,500 of those have been at our mobile clinics. In total, as of today, 66% of eligible adults have been vaccinated here in the city of Long Beach. That's a number that we should be certainly proud of. And we've discussed maybe about a month ago how important it was for us to get to that 70% number. And so we are on our way. We're at 66%. We've got 4 percentage points to go to hit that national threshold number, that 70%. That is really important, that President Biden has talked about, and that the CDC and others have talked about as well. And so we will continue to do vaccinations every single day to get to 70 and hopefully beyond, and of course beyond 70 as well. Our mobile clinics continue to happen. They're at Admiral Kidd Park, at Houghton Park, at MacArthur. We're going into people's homes for homebound neighbors. We have vaccination clinics at schools, at Cabrillo, at Grant, at Washington. And we've also opened up an evening vaccination clinic at Pacific Coast campus at Long Beach City College. And of course, the convention center continues to be open. I want to also thank the professionals at the Long Beach Health Department, who without their support, we could not be here today. Really it's a new day for the city of Long Beach, and it's a new day for public health in our community. Throughout this pandemic, all of our healthcare providers persevered. selflessly taking on this pandemic and taking care of patients and our families and community. They are really an amazing group. I'm going to have Dr. Davis is going to speak in a few minutes and talk about what's next coming June 15th. But I'd like to also introduce three of our CEOs who are all going to say a few remarks and kind of just share what this last almost a year and a half, 14 months or so have been like. So to start us off, I'd like to introduce John Bishop, who's the CEO, of course, here at Long Beach Memorial.
All right, thank you, Mayor, and thank you all for being here. It's hard to believe that just 6 months ago, we all stood before you at the forefront of hope. A hope that the vaccines would help rip our city back from the grips of the COVID-19 pandemic. We saw our very worst last December and January. The surge was at its peak, and almost every one of our hospital units had someone fighting for their life against this terrible disease. We even lost 3 of our very own. But today, California has one of the lowest COVID-19 infection rates in the United States, and our great city is edging towards its vaccination rate goal. As the mayor indicated, we're also less than a week away from California reopening, and that is because of all of you. So thank you all from the bottom of my heart. Even as we slowed the surge and staff were floating to COVID units and they were able to return to their own, I thought that our caregivers would want to take a break, but no. Instead, the emails were flooding in with requests to volunteer in our vaccine clinics. Our pharmacy team designed plans to ensure that successful pop-up vaccine clinics were available. And our very own doctors and nurses were staffing health education booths to try to stop the spread of misinformation and reduce vaccine hesitancy. You were all determined, and I'm grateful for each and every one of you. Let me also express my gratitude for city leadership. Mayor Garcia, you were out in front of this from day one, and you made our city a front runner and a national role model in the battle against this pandemic. For that, we thank you. Dr. Anissa Davis, thank you for being our light and giving us guidance when at times it felt so very dark. To my colleagues at St. Mary College, I want to thank you for standing tall alongside us during this unprecedented time. While there's still work to be done with vaccine hesitancy and health inequities, I know that if we all work together, we will get there. I couldn't be more proud of my team and the city in which I live and work. Thank you, and now I would like to invite Carolyn Caldwell, CEO of St. Mary's, for a few remarks.
Thank you, John. Good morning, everyone. I'm Carolyn Caldwell, CEO and President of Dignity Health St. Mary Medical Center. I've been fortunate to be part of the St. Mary family for the last 4 years, working alongside some of the most remarkable and dedicated healthcare professionals in Southern California. The past 15 months have been unlike anything we have ever experienced in our history. We have had unprecedented challenges, which forced us to make significant adjustments in the way we treat patients and run our hospitals. The days have been long, the hours spent caring for our patients have been taxing, and the preciousness of each minute has reminded us of the value of every moment we have together in this world. Since March 2020, we have treated hundreds of patients with COVID at St. Mary. Some didn't have the chance to say their final goodbyes to their loved ones. Others were forced to fight every minute they could with every ounce of breath they had. One of our own nurses, a 40-year ICU nurse, was hospitalized for over 6 months at our hospital. She spent countless hours dedicated to caring for others, and now she was a patient. Through the support of our care team and her family, she fought her way back to health, and in the process, inspired us all with her courage, her optimism, her resilience, and her faith. That same resilience and faith is what I see on the faces, in the spirits of our physicians and our healthcare team each and every day, and I could not be more proud. When the first COVID-19 vaccines were approved for distribution in December, it represented a glimmer of hope for all of us, and we hadn't seen very much hope prior to that date. St. Mary felt privileged that we were able to start vaccinating our healthcare team in December of last year. We followed the CDC and the Long Beach Health Department guidelines, and we were able to provide vaccine to other individuals who were eligible in our Long Beach community. So our staff volunteered, our physicians volunteered, and we were able to vaccinate over 7,000 individuals. That incredible number is a direct reflection of the hard work and dedication our teams embodied. I marvel at that commitment to our mission and to putting our patients, their families, and our communities first during this difficult time. I would also like to take a moment to thank Mayor Garcia, who was out front during this fight, not only locally, but also nationally. Also, our Long Beach Health Department and Dr. Davis, who took a lot of incoming, but she always managed it with grace, and she was definitely a beacon of hope for all of us. Our city leaders, our Long Beach Police Department, and our Long Beach Fire Department, for their continued support and collaboration. We could not continue this vital work without their partnership. The light at the end of this long tunnel seems brighter now than ever. I'm proud that St. Mary remains a beacon of hope for the Long Beach community, and that we will continue to collaborate with all of our partners to make sure that we work together to end this pandemic. Now I would like to ask Joe Avelina, the CEO of College Medical Center, to please come to the podium. Thank you.
Thank you, Mayor, and thank you, John and Carolyn. If you take a brief moment to reflect on the past 12 months during the pandemic, it's both emotionally overwhelming and deeply inspiring. I hardly know where to begin expressing my appreciation and unwavering commitment for the everyday miracles that are a result of our employees' care of our patients in the midst of COVID. I remember the first time COVID truly impacted College Medical Center when I received a call from my chief nursing officer of our overcrowding beds in the emergency department, as we were impacted on the backlog of patients waiting for the results of their COVID testing. Coincidentally, as we were to initiate surge capacity, I was laying on my bed at Kaiser Irvine as I was diagnosed with pneumonia. We eventually were able to get approval from the Department of Health to open up 13 additional beds. The weekend comes along, and after I was just recovering postoperatively from video-assisted thoracic surgery of my right lung, this time at Kaiser Anaheim, our team discussed plans to manage the surplus of patients in our ICU and the task of bedding our behavioral health patients who were COVID positive. During the beginning of COVID, everyone was scared, fearful, and anxious. But nevertheless, our frontline workers and hospital employees found the resilience to continue to come to work to care for patients. The collective impact of all the things our employees were involved is beyond amazing. As departments had staff who were out sick due to COVID or were suspected COVID, and as the census rose to above a bed capacity, staff stepped up, worked overtime, and when needed, helped out in other departments. An attending physician told me, quote, I still remember the names of many of the COVID patients we lost during the surge. The effects of the pandemic will be long-lasting. To our physicians and employees at College Medical Center, I would like to take this opportunity to extend my personal thanks. Thank you for your passion to care for others. You provide patients with comfort during their most vulnerable moments, and you demonstrate incredible strength, courage, and professionalism. I can't imagine a greater privilege than leading an organization at College Medical Center with such incredible success and inspirational people. I am incredibly proud and appreciate your efforts to work together so we can stay true to our mission to heal with compassion and perform with distinction. You have my deepest gratitude. So now let me reintroduce again Mayor Garcia back to the podium.
Thank you. Thank you to all three. And actually, Dr. Davis just had to step out right about 5 minutes ago for an emergency. But fortunately, I have her notes, so I'll be able to. And it's a personal thing. It's not city related. And so she had to step out, but she just handed me her notes. So I'm going to read her notes for her, and I want to thank her, of course. She wanted to say that starting next Tuesday, June 15th. The state and the city will be, of course, on its way to reopening. And while the situation is still fluid, we continue to watch the numbers and vaccination rates to see what can be allowed. She can share a few things with the public this morning. Here's a preview of what the California Department of Public Health is saying about June 15th. So starting next Tuesday, the California Department of Public Health is updating its mask guidance to align with the CDC and the latest science. The new guidance will state that on June 15th, masks will no longer be required for fully vaccinated Californians in public settings in line with CDC guidance. But there are a few exceptions to this rule, also set by the CDC. So as it relates to Long Beach and the CDC guidelines, as well as what will happen in California, masks will still be required in healthcare settings, long-term care facilities, on public transit, and at sheltering operations and correctional facilities. California will align with CDC and require face coverings for all people in those limited, unique settings. So I just want to make sure that that's very clear. Now, as it relates to workplaces, mask guidance we also expect will change around workplaces, but we have to wait for Cal-OSHA to set those rules. And of course, we know that is the occupational safety, the health board that works with California Department of Public Health. Now, the Cal-OSHA board, there's been a lot of conversations about what they're setting in place. They're actually having a meeting today. I believe it's most of today, where they are discussing what potential changes could change in the workplace post June 15th. So their goal is over the next week, the state will continue to release other guidance to align with CDC and lift provisions around the emergency orders that are in place. Now, I can say that it is from what I understand from the health department, the city of Long Beach is not intending on going more strict than the state requirements as it relates to the health order or as it relates to any workplace requirements set up by Cal-OSHA. But again, Cal-OSHA has not made its final determination on what those look like, but they should be out today, maybe tomorrow. And so once that happens, we will know exactly what the workplace rules are around masking. And again, that is a state decision. But with that, again, we want to just thank everyone. We are, of course, when you think about next week on Tuesday, and you think about the color coding system being eliminated, that also means you're seeing things like occupancy and all the rules around population inside of locations or the masking of individuals really dramatically change in the city, as well as limiting certain types of places, whether they are bars or restaurants or other retailers. So it will be a significant change beginning June 15th. And with that, I'll be happy to, if there's any questions or if any questions for anyone of the CEOs.
Thanks so much. So we have one question that comes from Lee at the Long Beach Post. Please take a look at an unmute yourself. Let us know who the question is for, and then go ahead.
Yeah, I can hear you.
Doesn't have to wear masks. And I was just curious if the city has a plan to kind of, I guess, regulate that, because, I mean, everybody could say that they're, fully vaccinated and that not be the case. And I mean, does the city have a plan to kind of like make sure that with everybody taking off their masks or being able to take off their masks in a lot of settings starting next week, that, it doesn't lead to higher case counts?
I think we can make assumptions. Of course, the health department will do, and I'm going to make an assumption right now. But before I do that, I want to say the health department is planning on doing it the best it can around enforcement, working with businesses, and just making sure that we do everything we can to keep people safe. But at the end of the day, there is no, the city's not putting in place any sort of show your vaccination card requirement at locations. And so there is a honor system that we are as a country are going to be living under. As a reminder, there is no law against you not wearing a mask if you'd like to continue to do so. I know a lot of people that are going to continue to mask up, and in certain instances, I personally will be in certain instances. But we are hopeful that people continue to do the right thing, and the health department will do everything we can around that issue. The other piece is we really are unable to fully answer that question until we have the rules from Cal OSHA, because obviously they are going to set some masking rules around workplaces that will impact what we're able to monitor. So once we have those in place, we think in the next 48 hours, we'll be able, I think, to answer that question more fully. But the health department will do everything we can to keep people safe, but a lot of it is going to have to be people being honest and keeping other folks safe. We all know that wearing a mask is not so much about protecting yourself, but it's about protecting others, and so that's has always been the case.
That concludes questions, and we'll now move on to Spanish interpretation.
Oh, great, thank you.
We'd like to thank all of the medical professionals who joined us here today. I know it is quite a warm day, so if you'd like to go to the shade, I totally understand. Thank you for being out here. Muchas gracias por acompañarnos. Hoy es nuestro comunicado de prensa para el 9 de junio del 2021. Hoy estamos en el Centro Médico Long Beach Memorial. Nos acompañó el alcalde García, representantes de nuestros hospitales, los profesionales médicos que nos acompañaron desde temprano. Es un día bastante lindo y asoleado, así es que ellos están moviendo a la sombra. También nos acompañó John Bishop, director ejecutivo del Centro Médico de Long Beach Memorial, Carolyn Caldwell, presidente y directora ejecutiva de Dignity Health en el Centro Médico de St. Mary, y Joe Avellino, director ejecutivo de College Medical Center. Queremos informar que hoy, hace 6 meses, administramos la primera vacuna. Entonces, es una gran celebración que desde entonces 250,000 vacunas han sido administradas. Es 250,000 de vacunas se han dado aquí a nuestros residentes. Y en este momento queremos también notificar que en el punto más alto de la pandemia teníamos a 220 personas hospitalizadas aquí en este hospital y ahorita solo hay 3. El próximo martes 15 de junio, junto con el resto del estado, pasaremos al siguiente capítulo de nuestro viaje de recuperación. Hoy queremos tomarnos un momento para extender nuestro agradecimiento a nuestros proveedores de atención médica por sus incansables esfuerzos y dedicación a nuestra comunidad. Primero quiero empezar también a darle las nuevas cifras de hoy. Hasta el día de hoy, un total de 63,468 residentes han dado positivo por COVID-19 y actualmente tenemos a 10 residentes hospitalizados con el virus. Hay 9 hospitalizaciones total por COVID-19 en los hospitales aquí de la área. Desde el comienzo de la pandemia hemos perdido a 941 residentes de Long Beach a causa del virus. Y también queremos informar que California ha podido mantener una de las tasas de casos de COVID más bajas del país. Según los datos publicados el lunes por los Centros para el Control y Prevención de Enfermedades, la tasa de casos de 7 días del estado por cada 100,000 personas es de 11, lo que coloca a Nebraska en el tercer lugar más bajo entre todos los estados, y solo Vermont y Dakota del Sur tienen tasas más bajas con 6, 9 y 9.2 respectivamente. La tasa de casos de Long Beach en 7 días por cada 100,000 habitantes es actualmente del 1%. El trabajo diligente de los proveedores de atención médica, el cumplimiento de las órdenes de salud de la ciudad y la distribución de la vacuna COVID-19 han contribuido a la reducción de las tasas de casos. Las vacunas han demostrado ser muy exitosas en la reducción de los impactos de COVID-19, pero solo el 52.7% de los californianos elegibles de 12 años o mayor han recibido la vacuna. Aquí en Long Beach estamos un poco más altos, a un total de 66% de residentes vacunados, muy cerca del 70% que es nuestra meta para la nación. Hasta la fecha, más de 250,000 residentes, como mencioné anteriormente, han recibido la vacuna y seguimos ofreciendo servicios en sus comunidades, como las clínicas comunitarias móviles en Admiral Kidd, MacArthur Park y Houghton Park, vehículos móviles de vacunación para personas confinadas en sus hogares y personas en vecindarios más afectados también. Vacunación móviles en las escuelas locales que incluyen la escuela secundaria Cabrillo, la primaria Grant y también la secundaria Washington. Vacunas nocturnas se ofrecen también en el colegio de Long Beach City College por la Pacific Coast Highway y además del centro de convenciones de Long Beach, como ustedes ya saben. Estuvimos aquí en diciembre cuando los trabajadores de nuestros hospitales de Long Beach estuvieron entre los primeros en recibir esta vacuna. Nuestro despliegue de vacunas progresó rápidamente a través de los centros de enfermería especializada a los trabajadores esenciales y al público en general para reducir esos impactos de COVID-19. Gracias a los esfuerzos combinados de nuestros profesionales médicos, el equipo de Departamento de Salud de Long Beach, el gobierno y los socios comunitarios, estamos aquí ansiosos por dar el siguiente paso en nuestro viaje. Durante la pandemia, los proveedores de atención médica han perseverado. Día tras día estaban en primera línea enfrentando esta pandemia, cuidando a los pacientes y ayudando a nuestras familias y estando ahí en los últimos momentos, desafortunadamente para algunos. Una y otra vez, los trabajadores de salud desafiaron el momento, enfrentaron el desafío y salvaron vidas. Todas esas personas son realmente héroes y aquí en nuestra ciudad y estamos tremendamente agradecidos por su servicio. Hoy celebramos el inmenso trabajo que los héroes de la salud han realizado para asegurar que todos estemos saludables durante esta pandemia. Ahora voy a hablar sobre los cambios que van a empezar el 15 de junio. A partir del próximo martes 15 de junio, nuestro estado y ciudad reabrirán más completamente. La situación aún es inestable y seguimos observando los números de casos y las tasas de vacunación para ver qué se puede permitir de manera segura. Pero esta mañana podemos compartir con ustedes un avance de lo que el Departamento de Salud Pública aquí en el estado de California sobre cómo será la vida a partir del 15 de junio. Empezando el martes próximo, el Departamento de Salud Pública de California está actualizando su guía de máscaras o mascarillas para alinearnos con el CDC y la ciencia más reciente. Esta guía indica que empezando el 15 de junio, las mascarillas ya no serán necesarias para los californianos que son completamente vacunados. Recuerde, se requiere que si toma la vacuna de 2 dosis, tenga ya las 2 vacunas y esperando 2 semanas, o la vacuna de Johnson & Johnson de una sola dosis. Hay excepciones a esta regla también establecidas por los CDC. Se seguirán requiriendo máscaras en entornos de atención médica, centros de atención a largo plazo, en el transporte público y en las operaciones de refugios e instalaciones correccionales. California se alinearán con los CDC y exigirá que todas las personas se cubran la cara en esos entornos únicos limitados. La guía de máscaras también puede cambiar en lugares de trabajo, pero debemos esperar que el Departamento de Salud Pública de California, CalOSHA, establezca esas reglas. La Junta de CalOSHA celebrará una reunión especial hoy para discutir los posibles cambios. Durante la próxima semana, el Estado continuará publicando una guía para alinearse con el CDC y levantar las disposiciones de la orden de emergencia que entrará en vigencia el 15 de junio, incluyendo el plano, la orden de quedarse en casa y el aviso de viaje. El gobernador tomará medidas para eliminar varias disposiciones de las órdenes ejecutivas. Una vez que eso suceda, nuestros funcionarios de salud podrán actualizar nuestra propia orden de salud. Recuerde que la ciudad puede optar por tener protocolos más estrictos, pero nuestra orden no puede ser más indulgente de lo que se permite aquí en el estado de California. Usted puede hacer su parte para ayudarnos a reabrir y permanecer abiertos al vacunarse. Les queremos agradecer a todos por su apoyo y otra vez una gran aplaudo y gracias a los profesionales médicos que han estado aquí ayudándonos durante esta pandemia. Muchas gracias por acompañarnos. Nos vemos la semana que viene. We thank you all for joining us. That is all for today. We will see you next week.